Absolutely. Here's a Puerto Rico Medical Board style clinical vignette focused on blackouts triggered by alcohol use and stress following relationship separation. Clinical vignette: alcohol related blackouts after psychological stress. A 37-year-old man presents to his primary care clinic for evaluation of recurrent blackouts. He reports that these episodes occur mostly in social settings, particularly parties or weekends, when he consumes alcohol. He is later unable to recall conversations or events, even though his friends report he appeared conscious and interactive during those times. The patient notes that these blackouts began after his recent separation from his long-term partner. He describes increased emotional stress, difficulty sleeping, and frequent binge drinking to feel better. There is no history of seizures, head trauma, or drug use. Neurological exam is normal. What is the most likely diagnosis? A. Temporal lobe epilepsy. B. Alcohol-induced anterograde amnesia blackout. C. Dissociative amnesia. D. Psychogenic non-epileptic seizures. Correct answer, B. Alcohol-induced anterograde amnesia blackout. The inability to recall events that occurred while the person was intoxicated is characteristic of an alcohol-related blackout. These episodes represent anterograde amnesia. New memories are not formed due to alcohol's suppression of hippocampal function, especially when blood alcohol levels rise rapidly. Emotional stress from the separation may have increased his alcohol use, worsening the risk for blackouts. The fact that others say he was awake and interacting during the episode rules out seizure or PNES. Key features of alcohol-induced blackouts. Feature, description. Memory loss, anterograde amnesia, can't recall events. Consciousness during events, appears alert, interacts normally. Trigger, rapidly rising blood alcohol level. Risk factors, binge drinking, stress, low food intake. Why not the others? A. Temporal lobe epilepsy, usually causes brief, stereotyped spells and often has auras not consistent with drinking triggers. C. Dissociative amnesia, involves retrograde memory loss, typically in response to trauma, not related to alcohol use. PNES, presents with motor activity that mimics seizures, but doesn't cause selective memory gaps during normal interactions. Would you like a